Hyperkinetic movement disorders are characterized by excessive involuntary movements occurring without weakness. These disorders include tremor, dystonia, chorea, tics, myoclonus, and related syndromes. Tremor is a rhythmic oscillatory movement caused by alternating contraction of agonist and antagonist muscles. Rest tremor suggests Parkinson's disease, while postural and action tremors are typical of essential tremor. Intention tremor indicates cerebellar dysfunction and worsens near the target. Physiologic tremor is present in all individuals and can be enhanced by stress, fatigue, hyperthyroidism, caffeine, or medications. Essential tremor is the most common movement disorder, presenting with bilateral postural and action tremor of the upper limbs. It often improves with alcohol and worsens with stress and may involve head, voice, or jaw. Treatment includes propranolol or primidone, with refractory cases requiring deep brain stimulation or focused ultrasound. Dystonia is characterized by sustained or intermittent muscle contractions, causing twisting movements and abnormal postures. Symptoms are often action-induced and may improve with sensory tricks such as gest antagonist. Focal dystonias include cervical dystonia, blepharospasm, and writer's cramp. Generalized dystonia usually begins in childhood and is often genetic, involving multiple identified genes. Treatment includes anticholinergics, baclofen, benzodiazepines, botulinum toxin, and deep brain stimulation. Chorea consists of rapid, irregular, non-patterned involuntary movements that appear semi-purposeful. Huntington's disease is a progressive autosomal dominant disorder, presenting with chorea, cognitive decline, and psychiatric symptoms. It is caused by a G repeat expansion in the Huntington gene, with anticipation leading to earlier onset in successive generations. Ballism is a severe form of chorea, with violent flinging movements, usually due to subthalamic nucleus lesions. Tics are brief, repetitive, stereotyped movements, often preceded by a premonitory urge and temporarily suppressible. Tourette syndrome involves multiple motor tics and at least one vocal tic beginning in childhood. Comorbidities include attention deficit hyperactivity disorder, obsessive-compulsive disorder, anxiety, and depression. Myoclonus consists of sudden brief shock like jerks that may be positive due to contraction or negative due to loss of tone. Common causes include post-hypoxic injury, metabolic disturbances, toxins, and neurodegenerative diseases. Treatment includes addressing the underlying cause and medications such as valproate, levetiracetam, or clonazepam. Drug-induced hyperkinetic disorders include acute dystonia, akathisia, tardive dyskinesia, and neuroleptic malignant syndrome. Acute dystonia occurs within minutes to hours and is treated with anticholinergics or antihistamines. Tardive dyskinesia presents with choreiform movements of the face and tongue after chronic neuroleptic use. Paroxysmal dyskinesias are episodic movement disorders triggered by sudden movement, stress, or prolonged exercise. Restless legs syndrome presents with an urge to move the legs worsening at rest and at night and relieved by movement. Management includes correcting iron deficiency, improving sleep hygiene, and using dopamine agonists such as pramoxole. Hyperkinetic movement disorders represent a diverse group where careful clinical classification guides diagnosis and targeted therapy.